also have a materials link to our website that includes the agenda as well as other materials that have been discussed during the meeting. Also want to thank all of our sponsors. Our first session actually is a supporter, so thank you so much. And also wanted to remind you about closed captioning. There is a button at the bottom of your screen that says CC, and that allows for the subtitles. Also a reminder that after the second session, the meeting will be closed to commissioners and their staff and NASMHPD staff. At the end of that day, or the end of the day, there'll be an opportunity to respond to an evaluation poll of the sessions, and your feedback would be really helpful to us. I am now going to turn it over to Brian Hepburn.
Thank you, Megan. It's my pleasure to introduce Heather Gotham to talk about the National Mental Health Technology Transfer Center Network Coordinating Office. Dr. Gotham is the director of the Mental Health Technology Transfer Center Network Coordinating Office. She is a licensed clinical psychologist and clinical associate professor at Stanford University School of Medicine. Prior to joining this Stanford last year, she worked with the Mid-American Addiction Technology Transfer Center in Kansas City and the Missouri Institute of Mental Health in St. Louis. Dr. Gotham, please go ahead.
Thank you very much, Brian. I appreciate the opportunity to be back here and speak to everyone today. I'm getting my slides set up here. Okay. Wow, a lot's happened in the last year since I last spoke to you a year ago at your meeting. And so I wanted to give you a little bit of update as to what our network is doing, what we have looking into our year 3, which starts in the next 2 weeks. So to remind everyone, the MHTTC network is part of the TTCs, the Technology Transfer Centers. We're funded by SAMHSA, and we're 3 sister networks. Of course, you're all aware, I'm sure, of the ATTC network, which has been around for now 27 years. So looking at addiction treatment, the PTTCs are also newer, similar to the MHTTCs, the prevention TTCs, and the MHTTCs were funded 2 years ago. Our network goals, we're really trying to focus on regional and our special population focused tailoring training and technical assistance to the mental health providers across the United States and territories. Our goals are to accelerate the adoption and implementation of mental health prevention, treatment, and recovery support, evidence-based practices. We heighten awareness and knowledge, skills of the workforce, foster regional and national alliances, and try to ensure the availability of free of charge training and TA to the mental health field. So there are quite a few new national TA centers that SAMHSA has been funding and sponsoring. I know you heard from the SMI advisor folks yesterday who are our cousins, we call them our cousins, to the MHTTC network. And again, one way I think that we differentiate ourselves in the TTC network is that we're regional and population focused. So really trying to have our feet on the ground and be attuned to regional needs, state needs, needs of yourselves. If you haven't reached out to your regional center, please do. Here's our map that shows where all of our regional centers are located. So again, we have 10 regional centers, 2 special focus areas, one on National American Indian and Alaska Natives, and one on, we have a National Hispanic and Latino MHTTC Center, and then our Network Coordinating Office. Another way that we are sometimes differentiated from the other SAMHSA-funded national TA centers is how we provide training in TA. So most of the other centers are based on TA requests. But our TTC networks all work in the same way, where we each develop an annual project plan based on regional or population needs. So each of our centers each year is conducting a needs assessment, trying to understand the needs of the region and the population, and then trying to spread our services across that region, looking at different states, different provider groups within states. So we're trying to spread the services around, We look at different intensities of services. Some of the work we do is universal, some of it's targeted, some of it's intensive technical assistance, and also try to be able to flexibly respond to emerging needs and be nimble. We, at the Network Coordinating Office, myself and Mark McGovern, who's the PI of the Network Coordinating Office, really have our fingers in implementation science and are trying to infuse our network in understanding how implementation science can inform the training and TA services we provide. So we're always asking our centers, the regional centers and the national focus areas, to consider the context. So when they do identify a need, when you identify a need to them, a training need or a need around a population or a specific topic related to mental health, prevention, treatment, and recovery, trying to have our regional centers really try and consider the context, what's really needed. So oftentimes people think that they need training, kind of that's the first thing they think of, but we really want to have people consider, maybe it's training, but maybe it's organizational development, maybe it's systems work, maybe it's policy, maybe it's more intensive coaching and technical assistance on an evidence-based practice. So that we're designing our projects really to have a high impact and not just provide training, which we know has a place, but doesn't really always lead to change in practice. As part of that, then we're having our centers look at what implementation strategies are specific to the need. So again, it might be training, but it might be one of these other things that's more intensive, that really has a higher impact, and always trying to focus on maximizing the impact on service delivery systems. So I think one of the ways that you might see this is when you bring a need to one of our regional centers, we hope that they're engaging you in this kind of conversation about what do you think is really needed. Many of our centers, when they're looking at beginning a TA or a training project, especially one that's intensive, might do some kind of readiness assessment with the agencies or the organizations that are going to be involved. SAMHSA had asked us, each of our centers, to develop a specific area of focus as well as providing services across, again, we have all of prevention, treatment, and recovery for mental health. So this is a snapshot of those areas of focus. These are areas in which the centers have a specific expertise, and they serve as consultants to our network. They develop national products and host specialty web pages. So you'll see that a number of these topic areas overlap with serious mental illness, because that was a key area that SAMHSA wanted us to focus on. But others vary from things like early childhood mental health to process improvement, integration of primary mental health care, rural mental health. So we do cover a wide range. As I said, we provide services across kind of the continuum from basic information dissemination through training, things that are more typically considered training, to technical assistance and implementation support. COVID, right? We have really been trying to be focused and yet broad in the services we've provided over the past 5 months. When COVID, first became so all-consuming in March, we immediately pivoted all of the in-person events across the network to virtual events. And then we started doing the hard work of trying to figure out what were the real needs. And one key area I think that we've tried to focus is on developing listening and support sessions to help states, systems, and providers. So here are a few examples of how some of our regional centers have done that. And they range from having more like mutual support calls for providers to looking at strategies, leadership, administrators, consultation, office hours. On the other side of the screen, you'll see some of the key topic areas that we've been working in that are specific to COVID-19. We've also tried to gauge the need for new clinical topics, for training, information, coaching on new clinical topics. As we've shifted to telehealth, clearly we, especially in March, April, and May, provided a lot of events and developed products related to telehealth specifically. But then as folks became more confident and competent in using telehealth as a platform, we were trying to understand what's the learning that is now needed related to clinical topics, so clinical innovations. We launched a nationwide clinical innovations in telehealth series looking at topics like suicide care, CBT for psychosis. How do you adapt evidence-based practices to this new telehealth platform? We've also tried to be responsive to SAMHSA leadership requests for specific resources. So SAMHSA came to us a number of times over the past few months and asked us to develop specific expertise surrounding topics like mental health disparities, grief, loss, and bereavement, and child abuse and intimate partner violence. Those kinds of requests led us to develop a few national series. Again, the majority of what we do is regional and tries to be really focused. But in this time of COVID, when things are so national, we have a number of national series that are trying to address all the needs of the mental health workforce. One in particular to bring up, I guess, is yesterday we had part 3 of a 4-part series on preventing and responding to family violence during COVID-19. So that topic of intimate partner violence and child abuse that we were asked to cover isn't a key focus area typically for the MHTTC. So we partnered with the experts, the National Center for Domestic Violence, Trauma and Mental Health, and the National Child Traumatic Stress Network to provide 2 series focused on these topics. For each of these webinar series, immediately after, or almost immediately after, we post the recording, the slide deck, and an FAQ document so that people who aren't able to view these can immediately go on and get the information. With both of these series, we've had, especially the first one, we've had over 1,000 people on most of the sessions. So we're really seeing an increase in participation. With our clinical innovations and telehealth learning series, that was a 4-session series we ran in May, June. We had over 3,000 participants live and then have had several other thousand people who have viewed the online recordings. If you visit our website, we have 6 COVID-specific pages, again, trying to get information to people in more chewable chunks, more topic-focused. So we've put together these specific COVID-19 pages. All of them are updated daily, and they list the MHTTC upcoming events, the products, including pre-recorded webinars, and a curated list of resources. I'm really proud of our network and how we responded. These are just some information from March to May. We held 125 virtual events, which for a network of 13 centers, I think is pretty remarkable. And during that time had over 30,000 participants on those live events. And then again, we're getting a lot of folks coming back and watching recording sessions. Also to have developed a slew of products, guides, tools, information packages, and we're seeing a lot of interest in those as well. Just to talk briefly about a couple of the specialty topics. The TTCs have been and are continuing to work internally within our centers and externally to promote mental health equity, to discuss directly the negative effects of racism, discrimination, and violence on mental health and substance use. All of our centers are working in this topic area, have been, and are now working in this topic area. In terms of mental health equity, this is just a list of a few of the events and products that we've developed. We're really excited about this 2-part series, Supporting School Mental Health in the Context of Racial Violence. And that's gonna start this Friday. It's a 2-part series, this Friday and the following Friday. In addition to the now all virtual events that we offer, we do have an online course platform. It's called Healthy Knowledge. This is the platform that goes across the 3 TTCs. All the courses on Healthy Knowledge, it's healtheknowledge.org. All the courses are free for certificate of completion or $5 per credit hour. Of course, with the ATTCs being around for so long, there's a range of courses, many of which are applicable to the mental health field as well. On the ATTC side, here are the courses that we currently have up and running on the mental health side. The new CBT for psychosis, which is listed at the bottom, is a really popular course. We also have a number of courses in development that we expect to launch in the next couple months on a range of other topics. We're pretty excited about those. Also on our main webpage, you'll see a slider or a banner that links people directly to our archive trainings. We have over 360 pre-recorded trainings. Those aren't for CE, but are really key information and easily viewable. Just a snapshot of what our National Focus Area Centers are up to. Last year when we participated in your meeting, we had representatives from our 2 National Focus Areas present. So I'm giving just a brief piece here. Our National Hispanic and Latino and National American Indian and Alaska Native Centers got together in the past year to develop this great new product called Culture is Prevention. It's a postcard series available on the website. We're pretty excited about that. They're very engaging and eye-catching. In addition, our National Hispanic and Latino Center has been working on developing curriculum around clinical applications of cultural elements, tailoring treatment for gender and sexually diverse Latinx youth with suicidal behaviors, a really great mental health disparities among Hispanic and Latino populations booklet. And they've also had a number of products and webinars related to intimate partner violence and child abuse in the Latinx population. The National American Indian and Alaska Native Center, always busy as well. They have a youth telehealth initiative, a Native Learning Academy. They've been working a lot with some of the suicide clusters in Native communities in places like Montana and South Dakota during the past year. They've also been hosting a really popular and engaging open forum called Strategies of Support. This is a weekly forum that's open to anyone, and it has really, I think, become a place of healing and sharing within the Native community. In addition to all the regular stuff we do, we have a special initiative, special funding from SAMHSA to look at school mental health. So just a brief snapshot of some of the resources we have. We do have a special COVID-19 page on our website that will show you what our upcoming events are. Again, the school mental health work this summer has focused on a lot of the COVID-19 specific topics related to wellness, related to trauma, and we're really starting to look at back to school planning and resources. I wanted to point out this really great product from our New England MHTTC. It's down there in the lower right corner. Their back to school after COVID-19 toolkit is really good. And we also have a couple learning series that are coming up and are going to be revamped as school gets started in August and September. Really trying to support our teachers as well as our school mental health professionals in dealing with this ambiguous and difficult back to school time. A main part of our year 2 work was to develop, at SAMHSA's request, an online course and website that's targeted at educators. Most of our school mental health work is targeted at school mental health professionals. So this work, this course and website that we're developing are focused on educators and really trying to get them to increase their understanding and strategies to promote student mental health and well-being and support students experiencing adversity, distress, and mental health challenges. So we will do a big shout out when this launches. It's going to be later this fall. This is one of the main things that got delayed with COVID. But we're working hard at making this something that's really going to be valuable to educators, that has a lot of great nuggets of how-tos, either in the classroom or virtually. So we're excited about this work. I know most of your meeting over the last 2 weeks has been about crisis services. So just to say, crisis services hasn't been a huge focus of the MHTTCs, I think because of the amazing work that NASHPD and other groups are doing in this area. Although we do have our regional centers providing very focused crisis services related events. I do think this is a great area where we could do more collaboration with NASHPD, and I'm looking forward to talking more about that in the next coming months. We try really hard, as I said, to collaborate with other national experts and centers. Know that we are not only not the only game in town, but a little bit late to the party, given that we've only been around for the past 2 years. And I really want to have us always thinking about what are other folks doing? How can we fill in the gaps? How can we join forces to share the meager resources that all of us have? So I'm very thankful to be able to coordinate with all these other groups. Here's how to reach us, mhttcnetwork.org. And again, always happy to have feedback about how we're doing, about what your needs are, and ways that we can support you. If you haven't, please go find your center through our main webpage and reach out to your regional center or to one of our national focus area centers. Thanks very much.
Thank you, Heather. Excellent presentation. You guys are doing some really good work, and we look forward to talking to you more about crisis services. That's been a focus of ours for a while, and we look forward to the collaboration. I wanted to see if Lynn Bashir wanted to make a comment. Lynn, do you want to open up, unmute?
Well, I see Lynn's comment in the chat about working with the Southeast MHTTC. Very glad. Janet Cummings at Emory is amazing. And certainly our colleagues at the National Center for School Mental Health at the University of Maryland in Baltimore are great partners. They've been assisting us in developing our school mental health curriculum in year 1, and now are working hard on the educator training that I just mentioned. Really glad to have that collaboration.
And there was a comment from Jim Cooler, if you see that as well, Heather.
Pacific Southwest, they are rock stars. So the Pacific Southwest MHTTC is located at CARS, the Center for Applied Research Solutions. I'm hopeful I have that acronym right. CARS is definitely an up and coming group. I should say that they have been around for quite a while, having other nationally funded SAMHSA TA centers. They have the Now is the Time Center. They have our South Pacific Southwest MHTTC, and just received the new NTAC award, and we'll be starting that in the next few months. So they are a great team as well.
Thank you. And as you mentioned, we've all been focused on COVID-19 and lessons learned. Is there anything that you've been emphasizing in terms of lessons learned that may go beyond the COVID period into best practices beyond COVID?
That's a great question. I think that we are, I think, some people early on talked about COVID as the great pause. And I think anytime that we're able to stop and think about how we provide training and TA services, how we help the field implement evidence-based practices, it's good to take a moment and really think about that. And I to some extent was worried when COVID started and we switched everything to virtual and we had all these, everything was a webinar, which is my implementation science heart just feels kind of sad about that, because I think that that's not the best way to get information. It's a good way to get information out. It's not a great way to get practice change. But one of the things I've realized is it has been a really good format to, I think, help the field get back up to date on some of the topic areas that where we have seen advances in practice, in evidence-based practice or in best practice, but people weren't as aware of it. So one example is suicide care. We did a telehealth and suicide care webinar to over 1,000 people. And the questions that were coming in from the field just made me kind of take a step back and think about, there's so many times when the field advances, again, at the evidence-based level, but that doesn't get out to all the providers. And because we've seen this great increase in the amount of folks accessing our really these basic services, I feel like we've now got a better sense, a better handle on what the field needs. And I'm hoping that we can take that forward into the future.
Okay, thank you. Well, that was actually a good segue into our next session. So we want to thank you for that, and thank you for the opportunity to hear more about the good work that you're doing. And we look forward to continuing to work with you over the next year. And hopefully a year from now, we'll be able to get together in person, and hopefully we'll be in the post-COVID period at that time. So thank you very much.
You're welcome. Please, my virtual door is always open. So I'm always interested in hearing from all of you about the good and the not good that the MHTTC network is doing, and really, really encourage you to stay in contact. Thanks very much.
Thank you.